Hey, thank you so much for joining us today during National Public Health Week on our second webinar. This is the Public Health Life. I'm Tracy Seward, the Senior Director for Outreach and Recruitment at ASPPH, and I'm really excited to introduce our panelists for today. So we have Crystalie Bastien, who's the Deputy Team Lead and Director of Encompass LLC, Emily Gordon, who's the Program Officer at the CDC Foundation, Marcus McKay, epidemiologist at Alameda County Public Health Department, Aishwarya Nagar, a research associate at the IRIS Group, and Junaid Siddiqui, manager at PricewaterhouseCoopers. All right. For today, I'm going to kick off with a few questions, and we will have plenty of time for questions from the audience at the end. Feel free to send them in the chat at any point, but we will be reviewing them later in the hour. If you have a question for a specific panelist, please feel free to mark their name first before your question. All right, so with that, let's go ahead and get started. I wanted to hear first about what brought you to public health. So who would like to start us off today?
I guess I can. Well, first off, thank you for joining us. My name's Emily Gordon. I'm a program officer at the CDC Foundation. And probably like a few of the other folks on the call, I took a little bit of a circuitous route to public health and actually went to undergrad and studied biology and Spanish for genetic counseling and thought I was going to end up in this clinical and like highly research focused position. And then as I was going through school and doing internships and interviews, I realized that public health was a better route for me because it's definitely more community focused, or at least the experiences that I was getting in public health are very much more community focused. You kind of have more impact sometimes than you do just in that clinical setting of one-on-one with a physician or healthcare provider with a patient. And it encompasses a lot of different perspectives between social determinants of health and health equity and culture and history. And that's something I really liked as well, of not only educating and working with the communities that you're a part of and working in public health, but also like working alongside them.
Yeah, similar to Emily, my path was also non-linear. I was a bio pre-med in undergrad and was really dead set on going to medical school. I went as far as, getting my acceptance to medical school. And I remember sitting in the accepted students day and looking around, and people weren't flinching at the eye-watering cost that medical school comes with, and it was around then that I was like, I don't know if this is going to work. But the second part of that was that as I was interviewing, I quickly started realizing that medicine obviously has its values and virtues in society, but you can only affect theoretically one individual at a time. When we think about scale, public health is really something you can enact change in mass. And that was kind of what drew me to it initially. And then what's kept me in the field is really, again, similar to Emily, just the interdisciplinary nature. I've done everything from lobbying on Capitol Hill to running my own startup to, being very deep in data science for various companies. And I think all of those have skill sets that lend themselves well to public health.
And I'll jump in. Similarly, I was studying pre-med in undergrad, and I sort of fell into public health by accident. I am Haitian American, so for me, being a doctor was my only option for life. And when I realized I didn't want to do that, I needed an out, and public health was my out of mom and dad, this isn't in between, public health. I'm going to do this for 2 years and go back to med school afterward. I didn't do that, but I'm happy I stayed in the public health space. And similarly, I wanted to stay in this space because of the flexibility public health offers. I worked in different countries, different continents, different teams, projects, and public health gives you that space to learn more about communication, community, and that's the best part, I think, for me.
Crystalie, I really relate to what you're saying because I had such a parallel experience, also pre-med in college, I was navigating my undergrad experience as an international student, knowing that my conceptualization of health and well-being was a little bit at odds with that of my peers. So there were these two parts of me, this one part of me that was doing wet lab research with flies and genetics and science and medicine, whatever. And this other part of me that was really dedicated to social justice causes on our campus, in our state, worldwide. And those two parts of me seemed at such odds with each other. And they were certainly not being satisfied throughout the med school application process, especially the dreaded MCAT. None of it scratched the itch of like, I want to do good in the world with transforming systems of power and oppression that perpetuate social determinants of health and social or health disparities. So when I learned about public health through one of my undergrad classes, I thought, oh my God, this is the answer I've been seeking this whole time. So I took a gap year. I worked in higher ed administration. I took the time to look into global public health and then decided, okay, I'm going to go into school for this. And it's been so fulfilling ever since. I'm so glad I did go to med school, which also felt like the only option for my Indian parents. So really glad to be here. I think public health really helped me and a lot of my peers kind of balance that part of us that wants systems level change, but also driving it through evidence-based research and practice.
Yeah, I could echo the same sentiments. I definitely did not know what public health was until my junior year of college. And after that, I had a conversation with one of my classmates, and she herself was going to nursing school, but also wanted to like pursue public health. Like, oh, what's that? And she said, oh, there's a field epidemiology. It's very cool. It's like, there's a lot of stats involved, but it's outside of like my biology track. It's more, the reason what drew me into public health was human-centric focused research. I didn't have to use animal models to kind of quantify some of the things and explain the anomalies we have in nature. There's data, there's research, there's statistics, there's registries, all these type of systems is already established. You just have to find a different angle to investigate. And I was interested in technology and how it intersects and kind of help us with data-driven decision-making. So those are one of the things that brought me into public health. And what kept me here is learning more about the policy, the social determinants of health, how to properly use the data-driven decision-making. What are some equitable, non-equitable ways that you can go through into uplifting a vulnerable community? So always like being creative about the way we view statistics and the way we discuss them to like further along a specific population.
I love it. I've yet to meet anybody with a linear path to public health, but I love, that's why I think it's so fun to talk to everybody and hear their paths to public health, because they're always so varied. And but there's always these threads of wanting to make such a big impact in the world. So also putting this panel together, I thought it was really fascinating because we have a really wide variety of what you can do in public health, and still we're just reaching, you know, a small bit because public health careers are so many different things. But can you give us a little bit of example of what your day-to-day like is in your current role, so we can start getting a sense of what might be out there?
Since I finished last, I'll sneak it way back for me. So I'm an epidemiologist by trade. Right now, I'm doing COVID-19 surveillance and research within our local health jurisdiction, which is here in Oakland, California, Alameda County. So on a day-to-day basis, I'm in charge of pulling records from our state registry, only pulling records that are in our local jurisdiction and making sure those records are of highest accuracy and of quality before we store those and archive those records for later research and predictions. We also maintain public dashboards that are widely available to anybody who is interested in Oakland, California, Alameda County health departments. And also, I'm sorry, I got my washer in the background. Long story short, I also perform a lot of quality control work and a lot of ad hoc requests when it relates to, let's say, multi-inflammatory syndrome, or any other type of health outcome from this coronavirus pandemic. So those are just some of my day in, day out basis. And it's very interactive, and I love the collaborative environment here at the health department.
Oh, go for it, Junaid. I saw you go off mute
Yeah, they're
first.
on mute. I saw you go as well. I'll quickly go then. So I'm a manager at PricewaterhouseCoopers, PwC. Consulting is a very unique place to be in right now, I think, since the pandemic, because there wasn't much of a public health footprint prior. And since the pandemic, obviously, there's been a realization that there's a lot of help needed in both the federal and commercial space. So I work in the commercial space at this unique intersection of human behavior, data science, and public health. And so my day-to-day involves kind of a variety of things, but as a quick example, part of my day, I do a lot of coding in Python. So a lot of my day involves building kind of behavioral science models through these large longitudinal data sets that are pretty widely available, whether through the CDC or FDA or so on. And I do a lot of modeling to understand how can we best approximate human behavior using synthetic data, which is like another kind of unique area right now. So it's not, the typical like case study is that AI is now able to build faces or facial features that don't belong to anyone that's ever lived, but they are human-like, if you will. So similarly on like the health behavior side, I work with data like that to better understand our clients' needs. Outside of that, I do a lot of work on the research front as well. So more on the mixed methods research. So anything from survey development to administering in-depth interviews, running focus groups, and really the whole gamut of recruitment and retention and all that as well. So.
Okay, so at the CDC Foundation, I actually manage a series of 3 grant programs, so federally funded grant programs. 2 are in veteran suicide prevention, which are very different. One is primarily focusing on public-private partnerships, so that P3 that's kind of you hear in the news and media all of the time, and thinking about the barriers and strengths and weaknesses and how we can overcome those barriers to create better and more sustainable partnerships between community-based organizations, federal entities, primarily departments of public health at the state level, and then private organizations. And then my other suicide prevention project is focused on evaluation, so building capacity within the local level, so community-based organizations that have preventative based programs for suicide prevention. So instead of looking at interventions at the point of crisis, how can community organizations and this idea of social connectedness really prevent veterans and military families and spouses from getting to that point of risk? And as a part of that evaluation project, I primarily provide evaluation-based TA, so qualitative and quantitative analysis, in partnership with our CDC counterparts, and then communications and dissemination TA. So focusing on how these outcomes and these understandings of evidence-based practices can become better models for suicide prevention. So building evidence-based science for that. And then also just providing that feedback loop back to the community. So the folks that they're working with and the partners that they have. My third project is a little unique because it's not only federally funded, but also privately funded through a couple of different organizations that work in sickle cell. But that is a surveillance and monitoring program, so data collection, and then there's a health communications component to it as well. So building a variety of resources and video campaigns that really like humanize what sickle cell is and the community of sickle cell as well.
My gosh, this is so exciting. I'm having so much fun hearing what the fellow panelists are doing too. And I'd love to add, if only to provide kind of what this looks like in the global public health world. So I'm working for a small boutique women-owned consulting firm that integrates gender equality and social inclusion in international development and global health projects. So what I love most about my job is that no day is the same. It's kind of a jack of all trades situation. So recently I was working on a 3-year USAID funded activity to improve menstrual health and hygiene in 4 workplaces in Nepal and Kenya. And so for that, I got to analyze qualitative and quantitative, so mixed methods data from these 4 workplaces. I got to go to our work sites in Kenya and kind of see what that inline process was like, which was amazing. And then kind of disseminate those learnings, distill learnings, and share them with our global community through webinars and conferences and papers. And then on another day, I was creating a gender strategy on urban sanitation for the Bill and Melinda Gates Foundation, which is such a cool process. You're, conducting these analyses on how does gender interact with urban sanitation in different cities? Kind of what can we do to improve sanitation outcomes? And so that was one of the first projects I worked on, and I had such a large imposter syndrome moment where I was like, who gave me the audacity to create a strategy for the Gates Foundation? But what I love is I'm working with colleagues in a very horizontal structure. So they're experts in their own fields, be it health or water and sanitation, or for another project I worked on where we did political economy analyses on child marriage. So, we're becoming experts overnight on these really critical key development issues. And throughout it all, I'm providing research and project management support. So it was so cool. I feel like I've experienced such a broad spectrum of global health, such a broad portfolio over the past 3 years. And I'm excited to continue growing that skill set. But my ADHD brain really appreciates an environment where I can work on something new every single day. So that part of me feels really satisfied in this role. And over to Chris.
We're gonna have to talk because I heard a lot of words you said that connected with my previous job, my current job. So I was most recently in Ivory Coast for about 2 years working on a reproductive health project. And that was so much fun. I got to work on abortion laws, work with the government. 1 week, it's either working with the government on working on a policy for abortion, then the next week convincing them why they should continue doing it because there's a new law in place or there's corruption or whatever's going on. So that was really fun and engaging to work with them. I got to work on a youth strategy, a Facebook bot for youth to ask a midwife, I have my period, what should I do? What does it mean? I got to create games like Are You Smarter Than a Midwife, similar to Are You Smarter Than a Fifth Grader in America. Disability advocacy. I hired about 10 deaf people to work on reproductive health projects with me. It was so much fun. Every day was different. I worked with 10-year-olds to 80-year-olds, community chiefs. It was just really exciting every day to work with them. And currently now I'm working on a human rights project with the government, with USAID. We work on political economic analysis. We do positive development, a lot of different trainings for USAID folks. I'm currently working on a disability policy we're updating. So I'm working with an advocate. Her name is Judy Human, who is amazing and has her own movie, a documentary on Netflix. Check it out if you are interested. So my day-to-day now is mostly working on those meetings with USAID officials, and we're currently planning a DRG, Democracy, Human Rights, and Governance Conference for June. So every day is different. No day is ever the same. But I do miss my reproductive health background, but I'm still finding ways to incorporate it into my current work. So with the positive youth work I'm working on now, I'm finding ways to talk about menstrual hygiene and all that good stuff. So it's fun, very flexible.
Okay, I just have to say, having known all of you as students, this is just so amazing to hear all this incredible work you're doing. And I know it's really resonating with the audience too. There's a lot of excitement in the chat. So thank you for sharing that. So again, thinking about the makeup of this panel today, I really wanted to target people who are not too far out of their careers because I feel like that's a more attainable thing to wrap your head around. But you obviously have a long way to go before you retire. So what kinds of things are you thinking about in terms of where you hope to see your career go from here?
I would love to start, mostly because I'm interviewing for jobs right now. So I've had to like think through this very religiously. I think, okay, I have one answer I give during job interviews, which is I would love to run the World Health Organization, or I would love to work for implementing organizations like CARE, or even funders like the Gates Foundation. But really knowing how meandering my path has been to get here, I feel like there's no point even like predicting where I'm going to go in the future, because a career in public health really sets you up to do anything. So whether it's the research or practice dichotomy I explore in the future that I'm still like straddling kind of somewhere in the middle, or going the pure consulting route, kind of like what Janet is doing, or working with academic institutions, or working with nonprofit organizations and civil society organizations, I feel like anything is possible being 3 years out of my MPH program. So yeah, there's like the higher level aspiration of like working with the UN, and then there's like the more proximate kind of, I would love to embody all of my idols and work either in implementing organizations or donor organizations doing research and practice work. So yeah, I feel like I'm gonna have the most vague answer. So others are welcome to follow it up with like, I know exactly what I want to do.
Yeah. No, I like really love your answer too, because there are so many different routes you can take in public health. And like, so I haven't always worked for this like intermediate organization. I did consulting. I actually worked for ASPPH in really a higher education role, and then strictly did communications and marketing for another nonprofit with this public health lens. So it really varied. Oh, I also consulted at the CDC. I always forget about that. So I've like worked in a variety of different roles in a variety of different organizations, which I think gives you a really good perspective in just what public health is, because it all kind of operates a little bit differently. And each of those jobs is giving you a skill set that you can take on to the next one. So Christy, I think you mentioned you used to work in reproductive health, but aren't doing that now. Like so many of those skills are kind of transferable. And it really sets you up for really any position you end up taking in the future. And one thing that I've learned in this role that I really like is the foundation and all of our programs are very strategic. So I like being able to bring that like strategic and intentional lens to our programs, which isn't always thought about at the local level. Like if you're working for a really small local community-based organization, it's a lot of like, we got to do this and we got to do this now. So thinking broadly in the context of the CDC Foundation is something that I really like, because it brings development and capacity building and really all these different voices to the table at such a larger context. So you can do a lot more sometimes. So that's something I don't, at this point, I don't have my dream job, but I know I could see myself at the foundation longer than just today, you know, because there are a lot of opportunities and you can bring those perspectives and that strategic development and working with advancement and private partners and our governmental counterparts that really makes an impact at any level we work at with our programs.
I want to interject for a second too, just because y'all are making me think about this. For those of you who haven't responded yet, or if you already did, are you doing what you thought you were going to be doing when you came into your MPH? No. Okay, I was just curious. Okay.
Do you want us to answer that of like what we thought we were doing?
I mean, if you want to add on, sure.
So when I applied for my MPH, I thought I was going to like go to grad school and work internationally and build these like countrywide health communications campaigns for nutrition or fitness or like chronic disease, so like diabetes or obesity, things like that. And I've definitely, since graduating in the past 6 years, a lot of my emphasis is on communications and marketing of public health programs, but I don't think I've had one nutrition related project in 6 years.
I've been doing some of what I said I wanted to do. I initially wanted to run or create my own disability-led focused organization supporting communities around the world. And I've done that to some extent in different countries. But I decided that I didn't want a disability focused job. I wanted to be the person to bring it into different organizations myself. So I wasn't stuck at one place.
I guess for me, I came in thinking I was gonna work in a like health system, which I did, but it wasn't really the environment I thought it would be. And I still have aspirations, career aspirations to collaborate with different sectors and kind of help mend some of the public health disparities in vulnerable communities. So if that future career goal of mine is outside of public health or with inside public health, I still want to be able to like collaborate, use again data-driven decision making, but with the health equity lens and context of the community that I'm serving to work and get a certain population up to the health standards that is fair, equitable, and can be thrived under. So yeah, at first I thought I was going to be in the health system because they're serving a specific population. The data is always there, but I end up at a local health department, which is phenomenal. It's a great route. We service a lot of square footage, square miles, and a lot of zip codes in our jurisdiction, and different cultures and backgrounds are underneath our umbrella that we service and cover. So I still get that need and that want to again use the statistics that we see on a day in day out basis to uplift the community that we're serving.
I know for me, coming in, I just wanted to be kind of your very like cookie cutter researcher. Like I just wanted to churn out peer reviewed articles. And I came into the program. It's so weird to say that now, but I came into the program thinking that, and I think within a year I was like, yeah, that's not what I want to be doing long term. And so, you know, I think where I've fallen now is kind of where I've fallen backwards. I taught myself how to code. I kind of built my own stuff just to test it out and see if I would like it. And I've, you know, failed along the way, I think a few times, but it's all led me to kind of the path I've taken and where I'm at now. And then Tracy, to your earlier question about like, I guess, dream job or like where I would see myself, I've become really interested in the last like 2-3 years in behavioral economics and behavioral design. There's a big researcher out of Stanford. His name's BJ Fogg. He's like probably one of like the most brilliant minds in the field right now, outside of like the founders of behavioral economics. And basically the work, how it applies in public health is understanding how design and how like your information architecture essentially can influence human behavior. And so, you know, I gotta plug my dissertation here because I have to do it, but my advisor would hate me if I didn't. I'm looking at home assistant devices right now, like Amazon Alexa and things like that, and understanding how you can structure voice-based skills in a way to best engage with somebody that's looking for information about their own health. So like my focus is on sexual health. So like think about college students, you know, you maybe have unprotected sex one night and you fear you might be pregnant or have symptoms of STD. The stigma associated with going to someone in person and asking that, or asking a physician, a friend, you're never kind of directed to the right information. So using a virtual entity to kind of overcome that stigma and feel like a safe space is something I'm focused on right now.
I'm getting so excited. I have to call you later as well.
Yes, please.
I love when our panels become networking opportunities. It's amazing. So, you know, we talked about what you thought you were going to be doing, but I also want to back up and understand what was your focus in your MPH, and what are the skills that you learned in your graduate degree that you're really using now?
I guess I can go. Skills being used now for me, a lot of my research methods came in handy. So any of the methodology courses, I wouldn't say any of like the advanced ones, but even just the basic intro ones have been very useful for me. in my day-to-day work. More interestingly, I think the electives I took during both my master's and my PhD ended up being more useful than some of like the core courses. And I had taken courses on like public health informatics, technology. I took a course through a consortium on coding, and those actually ended up being the courses that were most relevant then and now to my day-to-day work as well.
Sorry, did you say which area of study you had or focus area in your
Oh,
MPH?
I didn't. For my master's? Oh, it was community health. I was a double concentration in community health and health administration.
Thanks.
I guess for me, what most prepared me for my graduate, what prepared me the most for my program is, I guess, the language and writing skills in public health and communication. I am speaking to a lot of external stakeholders from the public health department who's trying to get a grasp of what the data says and how it's useful to them. And I have to word it in a way that is useful for them, but also relevant to the problem that they have at hand. Also, I did learn my fair share of consulting, like what does that really mean in the sense of public health? It's not, well, in my book, in my head, it's not really getting a question and trying to turn out the best solution. It's almost guiding people to the solution, or collaborating with the stakeholder, or kind of piece together certain things together and hope that you're close to the solution. So that's one of the things that prepared me in my graduate program. Another thing outside of, well, I also learned a lot of programming skills, SAS, RStudio, SQL, Tableau. Those are just tools that help me get to the overarching answer, or at least understand the data behind the question. So those are just some of the things that I feel most prepared me for grad school. Some of the tangible things like programming, but also the intangible things like writing and communicating and trying to consult. So I did my program in Masters of Public Health Epidemiology, and I got a graduate certificate in health informatics along with that.
I would agree with Marcus on language being what I learned the most from my graduate program. I was global health communication major, and I learned like Power BI, SPSS, all that good stuff, wanting to do a work plan, which is all very important, but I think not just language in terms of the tools they're using, but language in terms of people. So if Marcus is a policy guy, he needs policy evidence to communicate what I need to communicate to him. Or if Tracy wants to know more about how this programming is going to affect her health numbers in her country, I know how to communicate that. So just being very flexible in how you communicate things and pulling your SPSS evaluation experience plus your programming experience to tailor how you communicate to everyone you're working with.
Yeah, I agree with everything y'all have said. I wish I had paid more attention during my R, my SAS, my statistical software classes, because I've had to use a little bit of it, but I've also had to do my fair share of YouTubing, like how to cross tab and things like that. But I think, classes, obviously the core classes equip you with competencies you need in any public health job, which is how to be able to look at large amounts of data, synthesize learnings. Doing desk reviews and literature reviews was something that I became almost like the go-to person for at my job. So anything where you synthesize learnings from a large amount of information is super helpful. Learning how to communicate it to a variety of audiences, that's amazing. I think my global health focused classes, since that was my specialization, in particular my sexual and reproductive health classes, were really helpful in giving me the terminology I needed to navigate the field and understand kind of what everybody in the room is talking about when we're talking about various sexual and reproductive health issues or various global health issues. But in some ways, what ended up being more impactful than my classes were the research opportunities I became involved with, or the like random part-time job that I took up while I was in my master's program. So for instance, one of my professors She is a sexual and reproductive health expert. She's currently my colleague at Iris Group doing a lot of gender work. She walks into class and she's like, "Hi, I'm a gender specialist." I'm like, "Oh my God, I need to be her." So I think I bugged her every week for like months on end, being like, "Hey, if you have any projects or you need like an extra hand, let me know." And that worked out. At some point in my, I think it was in my second year, she reached out saying, "I need a team of students to do a bunch of literature reviews for this Gates Foundation led, what's it called? A systematic review on adolescent sexual and reproductive health outcomes." I was like, "Yeah, I'm your girl. Let me do this. Let's do this." So through that, I learned how to work with clients. I learned how to like take all of this knowledge that we had, theoretical underpinnings of it, actually apply it, which was so valuable. And it really helped me transition to the job I'm in now. So as much as the classes were helpful, the real world application opportunities, even the leadership opportunities where you get to interface with researchers, leaders, practitioners, those were enormously helpful for what I'm doing right now.
I just want to add to that because I completely agree with you. And the other thing I learned is being able to turn off my technical brain, because I know when you're, I look 12 in the real world and everyone assumed that I was 12. So whenever I was speaking, everyone would be like, "Crystal, you don't have no experience. What are you talking about?" So you have to have the language to say all the keywords everybody else knows. But if someone else in the room doesn't know that language, you have to turn off immediately to be able to communicate. Actually, this is what it actually means. And this is why it's important to you and what you should take down. So turning it off and turning it back on is very important as well.
Yeah, and I think that's a great comment, like tag teaming me off of what both of you guys just said, because this is really your first chance. Not only are you learning during your 2+ years, depending on how long it takes to do your MPH, but this is also your first chance to like become a subject matter expert. Like you're taking these topic area classes in nutrition or sexual and reproductive health or community health and behavior, but you're also learning all of the skills to like enact what you're learning. So I think there's a really great dichotomy between being able to experience that and take your subject matter expert and use it in the real world, which is why the practicum hours are probably so substantial compared to other master's programs, because you really gain that learning and understanding from actually doing it more than in the classroom sometimes. And unlike some of the other panelists, I actually didn't take very many hard skills. So like, I don't know how to do R. I don't know what Python is. Like, I can't do any of that. And most of mine were really focused more on that strategy or policy or built environment, and kind of thinking about how all of that impacts the health of what, and really the environments and what people are experiencing on a day-to-day basis. So my concentration was in global health and nutrition, and then have a background in social determinants of health. So I have more of these like soft skills that have been transferable to all of my jobs while I've been building that subject matter knowledge over the years as well.
Thank you all. All right, I have one more question before we turn to the audience. So I just want to also plug, this is a great time to put your questions in the Q&A, and then once we wrap this, we'll turn to those. But if you all could give a piece of advice to a prospective students, we have lots of students on the call today who are thinking about studying public health. So what advice would you like to give somebody who's thinking about studying public health?
I would say, reach out to people. Public health is such a large field. I think it's impossible to just read and get a good understanding of what you think you know about it. I found that when I was applying, I reached out to lots of folks on LinkedIn, and I just emailed them or reached out on messaging and said, "I'd love to just schedule an informational interview, just learn more about what you do." And through a number of those, I was able to get a good understanding of like, well, there's a wide variety of things that fall under the umbrella of public health. And once I understood whether there was an area that interested me, I tried to dive deeper and network with folks that were within that kind of specialized area that I was interested in. And then outside of that, my other advice is, I think there's something for everyone in public health. So I think a lot of people feel like, well, I don't know if it's exactly what I want to do, but I do have I have skills that I want to use, which are X, Y, and Z. I think public health is pretty unique in that aspect. Like I thought that myself about coding and wanting to use software and technology. And I was like, well, I don't think there's really room for that in public health. Everything has space in public health. You can even make your own space for it. It's just a matter of, you know, being willing to explore a little bit and just learn along the way.
On your networking note, I would add, be very consistent. I think a lot of folks are getting emails every day asking for a conversation and whatnot. So I was the annoying student who would email, Merry Christmas, Tracy, how are you? How was that presentation you did? Like, Happy Easter? Like, every single holiday, I would always email and follow up to see how they're doing, to get a time to talk with them. Sometimes their calendars get full really quickly. So just be consistent in terms of reaching out to people. And as a female in public health, I would say having those skills of SPSS are like the concrete ones you can write down and clearly say you have it is really important, because being a jack of all trades has been really helpful in terms of helping me progress in my career, in terms of, oh, well, you only have 3 years of experience. Oh, but you know how to do these 10 things that no one else knows how to do. It's really helpful in advocating for yourself and having those skills.
One other thing I would mention is also to like act on these conversations or your interests as well, because there are so many opportunities in grad school, not only to meet and network people, but actually like volunteer or get a part-time job or work on a lit review or conduct qualitative interviews. And it doesn't have to be, in most cases, it doesn't have to be something that you commit 6 months to or your entire MPH program. It could be something that a professor just needs help with for like 2 weeks, and then that's all. But that gives you that experience, and sometimes depending on the rigor of that work, that is something that you can put on a resume moving forward, and is a hard skill or a soft skill that you can say you know.
So this is all great advice. Wow, this is very good advice, very sound. My contribution to the workbook that we're generating here is get a note card or a sheet of paper and write down your research goals and interests. All 5 of them, or even 1 of them. Write down your research goals, your research interests, your goals for public health, what you hope to like contribute to the field or add to the field, or what you gain to take away from it, or any type of learning outcomes you want to encounter along the way. Reason why I say this, because number 1, you'll have to either write about these research goals and career goals. You're either asked about these research goals and career goals, interview because of these research goals and career goals. And though it may change, it's just helpful for them to be on a concrete sheet of paper for you to always refer to them quickly for an email, an informational interview, talking to faculty, talking to your collaborators, your peers. And it's just a little helpful nugget to remind yourself, but to also establish yourself in this field as well. So take the time out before studying public health to at least get some thoughts on a sheet of paper, and maybe in 2 weeks or 3 months or 5 years, that sheet of paper kind of changes and it's either added to or taken away from, but at least it's on concrete piece of paper.
I agree with Marcus. I think it's important to know how to pitch yourself and how to kind of, you know, when you're in front of somebody and you're talking about your interests, you want to be able to come across, you want to market yourself properly. So learning how to market yourself is very important. And if you don't know how to market yourself, the great thing about public health is there's so many avenues for learning. So there's the didactic avenues where you're taking a class as part of a Master of Public Health program, blah, blah, blah. There's also so much literature out there, some of which is publicly available, some of which is behind a paywall. You just got to get real creative about accessing all of it. And so constantly reading, subscribing to newsletters, kind of consuming bite-sized portions of information. Like Johns Hopkins is this really good global health newsletter that I read all the time. And so you could go that route. You could kind of pursue a public health job, a part-time job, an internship, a consultancy, something to give you experience. So there's all these kind of different ways to learn about what your interests are with public health or to grow your knowledge base. And the good thing about it is like, you don't necessarily have to commit. So if you want to market yourself as like I'm interested in global nutrition, today, and then tomorrow you're like, actually I'm interested in becoming a gender specialist, you can, because it's all compounding. All of these skill sets tend to be transferable, right? Like transdisciplinary problem solving, evidence-based research, like this is stuff you could use in any kind of realm of public health. So as long as you continue to learn, keep taking initiative, and then learn how to market yourself, I feel like you can really plug yourself into any environment, but then also picking up skills wherever you can. So, some jobs really do need you to know what you're doing on R, or some jobs really do need you to know how you evaluate programs, or, pull out like gender intentional indicators to monitor whatever you're doing. So you do need to kind of do a deeper dive in some of these cases. And the good news is that there are courses for this kind of work available online without you having to enroll in another master's or to kind of go through another program or having to do an entire doctorate.
Yeah, I would add, I believe everyone on this panel can agree that public health, like you need to remain fluid and flexible. Things change tomorrow, next week, in 2 months or 2 years. So being able to be flexible in your training, in your line of thinking, as well as your training, it definitely helps for you and for the people that you're serving, or the company that you're working with, or even your own company. Got to be able to be fluid and flexible.
Yeah, 100%. There's definitely aspects of my job that change on a daily or weekly basis. And the one thing that I've been finding, which kind of aligns with this, is public health is becoming so much more interdisciplinary. It's not just you're an epidemiologist, it's not just you work in community health. Like there are so many different fields getting involved in public health that it's really breaking down those silos and trying to create this more open framework of what improved health outcomes can look like and what improved community engagement can look like as well. So I think that kind of goes along with that idea of being flexible, but it's constantly changing. Like public health now looks totally different than it did in the 80s and what it looked like in early 1900s and even before then. So we're constantly learning as professionals as well.
Awesome. Okay, there are so many questions. So there's no way we're going to get through all these, and I probably can't take everybody for all the questions moving forward. Quick one, Crystalie, if you could drop in the chat the name of the documentary you mentioned earlier, that would be helpful. There's a lot of questions about choosing the right degree, and there's some about a dual degree or the MS preparing you for a PhD versus an MPH. So I just was wondering if you all could talk about kind of your choice in your degree.
So I have a MS in public health, which is a very uncommon, I think, degree choice. I chose it because, like I said, I was very set on going the research route. And so I felt like the MS was going to better prepare me for that. MS did have a thesis option versus I think it's a practicum for MPH students. So I felt like the thesis better equipped me for like a research career, which I was anticipating at the time. And then for my PhD, I felt like that kind of aligned well with like a more research focused background, and so that was kind of the intention with pursuing the master's.
Great. There's a bunch of questions about am I ready to pursue an MPH if I don't know exactly what my concentration would be yet, and or did any of you work for your master's and how that played into your experience?
I did an internship before my master's. Let's say that I did an internship in the summer before I started my master's program. I took a gap year, and just to explore my interest in, just explore the different concentrations in public health, and get a real good idea of what I'm going to sign up for for 2 years or 3 years or plus. And I also did an internship just to get some foundational base knowledge of what it's like to work in public health, meet mentors that have PhDs or MPHs or MS in public health, and understand their day in, day out basis, their work day in, day out. So my advice for that question would be participate in an internship, get your feet wet, at least understand if what I'm doing for this 2 months is something that I can do for 2 years plus, or I know there's online programs as well. There's shorter programs that maybe like 1 year. And is this something that I can do for like an extended period of time after I graduate? I think that would be internship would be my answer to that question. Just get an idea.
Agree. I think finding those mentors is really important just to understand what public health is, because it is so different and there are so many varieties of it. And you don't necessarily have to be next to University of Minnesota or University of Michigan. You don't have to be near a public health school to find that, because public health is happening like everywhere, all around us. So you can go to really anywhere you go, you can probably find public health, if that's at an elementary school or your church or a community-based organization or the local health department. So these people are in your communities, and I think the more you talk to them and the more you experience, that might help determine what concentration or area of study you want to fall into, because you don't necessarily need to decide, I want to be a gender specialist and work in community health, but I think having some sort of idea of where you fall in the very large spectrum of public health is really important going into it, not just from an admissions perspective, but a master's program is hard, and it is a lot of work in those 2 years. So you really have to be passionate in order to succeed.
I'm just going to add one more thing to that. I agree that you don't have to know exactly what you want to do when you start, but I worked for a year beforehand, which was helpful. But I will just add, as someone who's hiring people and a manager, it's nice to see work experience after getting a master's degree and before getting a master's degree, because my personal experience has been, I've gotten a lot of students who went straight from undergrad to grad school, and then their first day never had any work experience, and they're telling me, Christy, I don't order coffee. I'm actually writing gender policy analysis. You have no work experience. What do you mean you should be writing a report on XYZ? So please don't be one of those students. If you are, please don't do that. I would really appreciate that. Okay, end of rant. Continue. Everyone else.
Oh, that's hilarious, because I think I might have been one of those students at some point. But I would love to give like inside information. I worked for admissions for my program, and we used to have people who had anywhere from like 0 years of work experience. They were coming right out of undergrad, and they were like, I have this thing that I'm really passionate about, to people who are like, I'm exploring, something in public health. And you're like, okay, great. So we've got that too. And then there were people who had, maybe 5 years of work experience. There were people who had lived an entire life and were like, I would like to pivot to public health. And, kind of what Jeanette said earlier about public health is for everyone, that really applies to this context, because public health is what you make it, or specifically your degree in public health is what you make it. So, if you have no work experience, but you are guided by a principle, a research goal, like something is driving you, kind of like what Marcus was saying earlier, then make sure you're emphasizing that. If you're kind of, you don't really know what's going on, I would highly recommend getting some research experience, work experience, an internship, anything that allows you to actually practice your interests in like a way that doesn't perpetuate harm to the community that you're working for. That is super, super, super important, because it's a 2-year degree. You're paying for it in a lot of cases. So just to make that money worth it, make that time worth it, it is important to at least have some sense of direction. But then again, if you're going to a master's program to figure out what kind of public health you want to do, that's valid too. As long as, when you land up there, you're taking advantage of the networking opportunities, the research, the work, the classes, all of that. So as long as you're guided by some level of intention, that would be really helpful. Any amount of work experience really helps. And as long as you're marketing it, I think you're going to be okay. Marketing it well, you're going to be okay.
Right, since we're talking about work experience, there's a bunch of questions and concerns about how do you find that first job? And also, if you don't have public health experience prior to your degree, how do you talk about that when you're looking for that first job after your master's?
Echoing about it's public health is what you make it, and like the master's degrees and the PhD programs is again what you make it, and not having that prior public health experience or little to no public health experience, you still are very valuable to this field. Your knowledge, your creative thinking, the way you see problems, that's all the much more helpful to the field of public health. How you carry yourself, how you portray yourself matters even more. How you write for yourself matters even more. You do have work experience. That's what one of my career advisors said. You do have work experience. It may not always be in public health, but it's relatable. It feeds into some of the mission, some of the research that you want to do, or it feeds into one of the roles that you want to reach out for. You just have to find a bridge, some sort of connection with your work experience to that job, to that role, to that research, and it'll be all the more convincing. So again, it's like I will echo, it's very much so what you make it, and how the steps that you want to take can get you to your end goal. But please do not fear, not having public health work experience or no work experience at all. You just have to, again, find a solid research topic, understand what that comes with it, understand the steps that it takes to achieve that research topic or the public health goal, and then be able to tell others confidently, this is what you set out to do. This is the steps that I'll take it. Here's the steps that will take to get to the end goal. And you can help supplement, assist, XYZ. So yeah, that's my answer to that question.
I would say you have to be super creative. If you get one opportunity, trying to figure out ways to double that. So I had to go to Ghana for something, and I offered to stay for another 2 months to help them create like a whole different program. So I was a consultant. That was a job technically afterwards. So finding ways to be creative and getting opportunities and asking to do more of, or I have this quality or this expertise. How can I help you in this project instead? So finding ways to extend your opportunities is really helpful.
And then I'll also say that, having a non-traditional background is a benefit in public health. I think some of the biggest contributors in the field were not like your cookie cutter public health major in undergrad, public health master's, public health PhD. They come from different disciplines, and it's that diverse background, those experiences that contribute to what being a public health professional is all about. It's about drawing from your vast array of experiences, drawing from even your own life. Like all these things make you a better professional, and all these things are relevant, I think, as you think about public health.
Right, y'all, this is amazing. I think there's so many incredible questions that we didn't get to. We could talk for at least another hour or 3, but I do want to be respectful of everybody's time. So I'm going to drop a couple of links in the chat. One is regarding careers. If you're looking for jobs, you can check out publichealthjobs.org. Also, I'm going to drop our website. If you like today's webinar, we do have 2 more coming up the rest of the week. Tomorrow, we have one about how to get experience in public health, and we have opportunities with Health Career Connections and Summer Health Professions Education Program, and the CDC are going to be talking about that. And then on Thursday, we have the authors of 101 Careers in Public Health, who will be on to talk about careers in public health. So the second link is so that you can check those out and register if you're not already. But thank you all again so much. I love this. I learned so much. I thought you all were amazing. And so, I can tell the audience is super engaged into what you are saying. So thank you for your time today. Thank you, everybody who joined us. Oh, there is a question about connections. So if you're open to connecting and you want to drop that in the chat, link social or email, that's fine. But other than that, thank you all so much and have a wonderful day.